we've been part of the High Impact Users Group since it was started, and it's really got all our partners together within the community, from the ambulance service, GPs, our colleagues in P3, the local authority, police and other agencies, to think about and support service users who have been regularly attending A&E and thinking we're not quite meeting their needs. How can we do that better?
When you've got to a point where there's some people that you've sort of exhausted all sorts of support for them, it's just brainstorm into which agencies, which professional can actually carry them forward.
As a nurse in A&E, we see people that frequently attend, which could be daily, multiple times a day, multiple times a week.
People tend to use the ambulance service quite a bit because we will go. As part of the group, we've found that when they can access more appropriate services, it's really reduced our calls going out to them. So it makes it then we've got ambulances available to go out to the people that really do need it.
Usually there's a social aspect to why these people have attended the department. A lot of people are lonely. A lot of these people have come from, they're care leavers, so they struggle to live an independent life on their own. I think the High Impact User Service is a very good thing to have come about. The service has been able to look at the bigger picture and help them with day-to-day skills.
There's a young lady who was calling our urgent advice line, was regularly being seen by the ambulance crews. The police were out many times to her. She was very distressed, upset, and having a really challenging time. And after much engagement and work, and thinking less about therapy and perhaps mental health services, she was able to get a job, started working full time, and looked at other aspects of her life. Her life improved immeasurably, and her reliance on our services and attending A&E has really almost come to a halt.
The link work that's going on is absolutely invaluable to be able to get down to the root cause of some very complex and chaotic lifestyles, and P3 are able to bring an informal and approachable service which reduces the barriers brought by me turning up in uniform. Nobody really wants to talk to the police about such personal matters, and nor do we have the time that P3 have to be able to sit and give that dedicated service to members of the public.
I think having a team of people who really understand like coaching techniques and motivational interviewing techniques has been really, really beneficial. I think it's easy for us as healthcare professionals or any other kind of professional to say, well, you know, this is the right thing to do, this is going to give you the best outcomes. But if we don't say it in a language that really resonates with that person in front of us, they're not necessarily going to see the benefit of it and sort of take that, you know, that advice on board.
I believe the P3 approach is effective for patients because as professionals we only see a snapshot of the patient when they come in for a 10 minutes consultation, so we can't really appreciate what they go through on a day-to-day basis. But having a key worker, having someone who is with them most time of the day, who can visit them at home and really see what they're struggling with, does add a lot of value to their lifestyle. And for us, when we get the feedback from the key worker, we're able to, you know, as professionals interpret it and know how further to help the patient.
All I want is to say thank you to the service for what they've done for me and for the help they've given me, especially Hayley. I tried to take my own life and I phoned the police because I was trying to jump in front of a train and I needed someone to talk to because of losing my mum, and I haven't got no one I could talk to, so they were the next best thing. But I've got Hayley, I've got the mental health team coming up to help me. We've gone to inquire about a rethink group, me going swimming, like exercise. She took me to Dad, we've been for meals together, we have chats on the phone, so I know at the end of the day she's there for me.